Have you ever opened a medical bill and wondered what you were actually paying for? Not just the total, but the individual charges, the unfamiliar codes, and the adjustments that seem to appear without explanation. For many patients, the bill itself raises more questions than the medical visit that came before it. You may recognize the hospital name, you may recognize the date, but the rest of the document can feel strangely unreadable. In the United States, medical bills are not only expensive, they are often confusing by design. Medical bills follow a system most patients never see. A system built around pricing rules, billing codes, and financial negotiations that happen long before a bill ever reaches your mailbox. This system operates quietly in the background. Separate from the exam room, separate from the treatment itself. Even when nothing goes wrong, a bill can still look wrong. And when something does go wrong, understanding the charges becomes even harder. This isn't about blaming hospitals or doctors. It's about understanding how the system actually works and why patients are often left outside of it. Medical bills weren't created for patients. They were created as technical documents designed to communicate between healthcare providers and insurance companies. What looks like a simple invoice is actually a detailed record of how the system accounts for medical care. Each line item represents a service, a process, or an administrative action that occurred during treatment. Some of these actions happen in the exam room. Others happen entirely behind the scenes. Many of these details are necessary for insurance reimbursement, regulatory compliance, and internal accounting. But they are rarely explained in plain language. Patients are not given a guide. They are not shown translations. And they are not told which parts matter most. As a result, patients are often asked to interpret a document that was never written with them in mind. Every medical service in the U.S. is translated into a billing code. These codes are standardized and used nationwide. They function as a shared language between hospitals, clinics, and insurance companies. They determine how much a hospital charges, how much insurance will pay, and how much the patient may ultimately owe. A single hospital visit can generate dozens of separate codes. One for the room, one for the doctor, one for tests, one for equipment. Sometimes even one for administrative processing. To patients, this feels chaotic. The codes appear without explanation, often listed as strings of numbers with no plain language description. To insurers, however, this is simply how the system communicates. The issue is not that the codes exist. It's that patients are rarely shown what those codes mean or why they appear on the bill at all. Another reason medical bills are confusing is the role of insurance adjustments. The price listed on a medical bill is often not the amount anyone actually expects to pay. Hospitals and insurance companies negotiate rates in advance. These negotiations happen privately. Patients are not part of them. What patients usually see is a sequence of changing numbers. First, an original charge, often much higher than expected. Then, an insurance adjustment that reduces that amount. And finally, a remaining balance presented to the patient. What patients rarely see is how those numbers were calculated, why certain charges were reduced, or why others were not. This process happens quietly, behind the scenes. By the time the bill arrives, the financial decisions have already been made. As a result, the final bill often feels unpredictable. Even insured patients can receive unexpected medical bills. This can happen when a provider is out of network, certain services are not fully covered, or multiple departments bill separately. In many cases, patients have little control over these details. Because billing is fragmented, patients may receive bills weeks or even months later, often with little explanation, and no clear connection to the original visit. What feels like a single medical event can turn into multiple bills, arriving at different times, from different departments. For many people, the confusion continues long after the medical care has ended. Medical bills in the United States are confusing, not because patients are uninformed, but because the system was never designed with patient understanding as a priority. Medical billing exists to manage reimbursement, regulation, and coordination between institutions. Patient clarity is often secondary. Understanding how medical bills work doesn't make them cheaper, but it does make the system visible. And visibility is the first step toward accountability. That clarity can help patients ask better questions, track their bills more accurately, and reduce unexpected surprises.